What's going on, everyone? I'm just a typical average American here today to react and learn about the Canadian healthcare system versus the American healthcare system. How would one describe the American healthcare system? Convoluted, expensive, at times cruel, and downright bad, honestly. Most Americans, I think, would be very willing to agree with all of that, and yet, it seems like as time goes on, and even as we point out these things, nothing ever seems to change. For a variety of reasons that maybe we're going to get into during this video, but Americans still like to talk about what could be improved, and they like to point to shining examples around the world of what our healthcare system could look like. And one of those shining examples of a really well-run and well-designed healthcare system is Canada. Canada is constantly being pointed to as an example by Americans of what life could be like, if only, if only. So I have this little video here that's going to make a lot of comparisons between the fundamentals of American healthcare versus Canadian healthcare, because even though a lot of Americans acknowledge this, many, including myself, don't understand every single little detail about the Canadian healthcare system, so I feel like this is going to be a good educational opportunity for me, and maybe an opportunity for me to go on a couple of rants about how bad the American healthcare system is. You've been warned that might happen. So with that being said, let's take a look.
Healthcare consistently polls as one of the top issues for American voters going into the 2020 election.
Yeah.
A lot of people who...
Yeah, I mean, like, this was made in 2020, and he's saying healthcare is a top talking point in going into the election. Nothing ever really happened. Not much got better, even though a lot of people point to healthcare as something important, for something they'd like to consider when voting for somebody into office in America. Well, we're in the future now, and nothing ever really changed.
Who aren't happy with the American healthcare system seem to think we should adopt the Canadian way. Others say Canada's system isn't as good as it sounds. Tonight, we're going to look at the basics of both systems.
Right, so as he's pointing out, one of probably the most common country Americans point to is Canada for what healthcare could and should look like. Oh. Ambassador Bridge. I need to watch a video on this bridge. This is obviously a bridge between America and Canada, right?
America and Canada. Allies in politics, rivals in sports. We've got a lot of things in common. We both speak English for one, though they're pretty good at French too. We both love Celine Dion and Garth Brooks.
I'm loving this little this little comparison they're doing here. This is good stuff. This is classic American news.
There are some differences, however. Baseball, that's our national pastime. Theirs is hockey. They also like the metric system. We still use the king's foot for our measurements.
The king's foot. Maybe that's our problem with some of our healthcare. Maybe that's a sign that we need some updating in some of our systems. We're still out here measuring stuff in the king's foot.
But no subject whatsoever gets more attention when drawing discrepancies between the two North American neighbors, like healthcare.
Yeah.
In America, liberals tend to lionize the Canadian system. Conservatives pan it. So what are the facts? First, the histories. The U.S. healthcare system sprung up mostly during the Industrial Revolution. Factories were dangerous, and emerging unions fought to have employers pay for injuries and illnesses workers got on the job.
Huh. This is actually... I didn't know part of this was going to be a history lesson. Even the history of healthcare in America is something I'm not totally brushed up on. And the history of healthcare in Canada, this is actually, like, fascinating.
In Canada, this guy, Tommy Douglas, developed their single-payer system in the 1960s.
Tommy Douglas? You can point to an individual? Like a singular Canadian who is known for developing the Canadian healthcare system. That's pretty amazing.
This guy, Tommy Douglas, developed their single-payer system in the 1960s. Some polls say he's more popular in Canada than Wayne Gretzky.
What? Whoa! Now that's saying something. But I mean, if you're the guy who invented, I'm sure a lot of people, very smart people, were involved in actually developing all the nuances of it. But if you're the guy who's known for pioneering the Canadian healthcare system, maybe you are more popular than Wayne Gretzky. Is that possible?
Canadians pay taxes for their healthcare, and each province or territory provides medically necessary services with that money.
Yeah, see, that's already the first biggest difference right there. Canadians pay taxes, and those taxes go towards healthcare coverage and providing healthcare. I feel like Americans would be ecstatic. We would be over the moon to pay taxes that we know what they're going towards. They're going towards our healthcare, because that's a whole other issue where Americans really aren't sure what their taxes are going towards half the time. But if I knew my taxes were going towards healthcare coverage for me, oh man, I would be so happy to pay my taxes. So I feel like so many Americans would agree with that. Like, that would be such a great way to do it. And speaking of paying for things, I have a bit of an announcement. A very special announcement that I'm very, very excited to reveal here. The very first ever Tyler Bucket merch t-shirt. The Tyler Bucket t-shirt here. If you're a fan of the channel, if you're a fan of what I do here, you might even recognize this phrase. I'm just a typical average Canadian, though. The typical average Canadian t-shirt. I decided to swap out that word. Usually I say American because I'm referring to myself. Typical average Canadian, to have a little fun and a little opportunity for any of my Canadian fans out there. I'm actually wearing the shirt right now, honestly. Yep, there we go. Some Canadian, I couldn't help it. I got some Canadian surprises sprinkled in there. So if that's something at all that you'd be interested in looking at, feel free to check out tylerbucket.com. I'll be sure to leave a little link in the description below this video. So if that interests you at all, feel free to check that out. Even if it doesn't interest you at all, even if you hate these videos, feel free to check it out. But no, thank you very much for watching. That's all. That means the world to me. And if you check out the t-shirt, thank you very much for that as well. And if you're just sitting there waiting for me to finish up with the whole t-shirt thing, you are in luck as well, because let us continue.
But here's a catch. Each province or territory gets to decide what medically necessary means. There are a lot of different estimates, but Consumers Mutual says the average Canadian pays about $160 per month in taxes for that basic coverage, or about $2,000 a year.
Wow! That is... Americans would be over the moon to pay for healthcare using taxes. And even if we were doing it like we are now, where Americans have to purchase private insurance plans and pay a monthly fee to keep that going, if it was only, what was the number? $160 a month? That's about what it equals to for Canadians paying taxes. Monthly payments would be $160. That would be better. Even if we stayed exactly how we're staying. If we paid $160 a month, $2,000 a year, I think he said. Oh my gosh. I have this document pulled up. Health insurance premiums have risen dramatically. Just to look at health insurance monthly payments for most Americans. In 2023, the average cost of individual health insurance for a 40-year-old on a silver plan is $560. 40-year-old on a silver plan. I mean, the fact that our plans are even named oh, are you going to get the bronze plan or the silver plan where you're kind of covered by some hospitals, and $560 a month. Ugh. Yeah. Luckily for me, I get healthcare coverage through my day job, which most Americans greatly rely on and greatly look for is a job or an employer that will help pay and supply a medical plan for them. Otherwise, you're going to have to go to some private insurance business or the government and end up paying a lot of money. A lot of money. Yeah, that's a whole thing.
Private health care still does exist north of the border, but as a supplemental option, and a lot of Canadians do buy that. In the United States, our employer-based system varies wildly. We pay premiums every month, and if we need to actually access health care, most of us have to pay hundreds or thousands out of pocket before that coverage ever kicks in.
Isn't that funny? That we're paying huge amounts of money every month just in case we have to go to the doctor or the hospital, just in case something happens. We're buying health insurance. And then when that something finally does happen, you trip on a rock and you cut your leg open or break an arm or whatever happens, or you come down with an illness, you go and you're still going to pay a lot of money depending on what is covered by your specific plan and what your specific plan, what percentage of the costs it covers, how much your deductible is, or the amount of money you have to pay first before your plan kicks in and starts paying. And all of these variables just are wildly different from person to person, causing even more mass confusion, basically.
eHealthInsurance.com says the average deductible for individual plans is $4,358.
So the average deductible for individual plan, and this is
$7,983 for a family plan.
So the amount of money you have to pay, if you go to the hospital and you need a life-saving surgery, you're going to pay $4,000 or $7,000 if you have a family before your insurance even starts to pay for anything. And then on top of that, if you're getting something that costs a lot of money, like $100,000, your insurance might only cover 80% or something of the total costs, even after the deductible, which means, 20% of $100,000 is $20,000. So that's a horrible situation to be in as well. Basically resulting in a system where many Americans are simply scared to go get health care, to go to the hospital, to get in an ambulance, to seek help. They are afraid because of what the costs, what the financial ruin could be on them. Now, luckily for a lot of Americans, I think the majority of Americans, the majority of the time, Americans do have a health insurance plan, and it is going to cover the vast majority of whatever they need done. And I think that's part of the reason why this system stays, is because enough Americans get by. Most Americans don't encounter this scenario. But, this horrific scenario does occur to the unfortunate few, which I think is just sad that that is a possibility in America, a nation that kind of prides itself on thinking we're some kind of global leader, a global example. We're not even taking care of our citizens that are most in need. So I feel like that says a lot.
Let's say your premium is $200 a month. For a family, you are closing in on $10,000 a year before you see any coverage.
$10,000 a year, like to many Americans, is like barely doable. Barely.
And that's just what workers pay. On average, U.S. employers pay more than $13,000 per employee. Okay, consequences.
Right. That's for if you're getting your health insurance through your job, which most Americans are desperately wanting, and many people thankfully get, myself included. Your employer is helping to pay for a lot of your health insurance plan.
Of the cost. An article in the American Journal of Public Health shows more than 2/3 of all bankruptcies are because people cannot pay their medical bills. Canada does still have that problem too, but to a much lesser degree. 15% of people 55 and older who file for bankruptcy in Canada do it because of medical costs.
See, that's an example of something that I don't really understand about the Canadian healthcare system. He mentioned that some Canadians do purchase private healthcare insurance, and apparently 15% of people 55 and older who are filing for bankruptcy are doing it because of medical costs. I don't understand the situation that would necessitate this, going bankrupt in Canada because of your healthcare expenses. That's something I'd be interested in maybe learning about.
And like in Canada, most lifetime caps are prohibited by U.S. plans. But before Obamacare, as an example, if you had cancer, they may have stopped paying for your treatment once you hit $1 million. A big thing people talk about with Canadian healthcare is the
Which is, oh man, I told you there'd be rants today. This is extra amusing to me because a lot of hospitals are basically run like businesses in America, where they are purposefully charging a lot of money for the most mundane of services, like casts and for medicine and even a Band-Aid. Like if you look on your bill, there's stories of people like being charged $100 for a Band-Aid when they actually looked at their medical bill. So the hospitals have the complete power to charge whatever they want, like any business. Same for pharmaceutical companies. There are some laws in place, for absolutely life-saving drugs and whatnot, and patents and how that stuff all works. But it's just kind of wild that we live in a scenario where we're basically at the whim of a business for something that you need. You need healthcare. It's not like a sack of potatoes or like a bottle of ketchup where you can just not buy it if it's too expensive. You have to buy healthcare, or in many cases, like, it's not going to be good, to say the least. Or, you could die or lose a limb or, have some kind of life-altering, life-changing, horrible thing happen because you're not taking care of something. And, like I said, the fact that that is all a reality in America is scary, honestly.
Wait time, and yes, some estimates say it could take 22 weeks to see a specialist after your primary doctor makes a referral. Even just getting an MRI could take a month. In the U.S., it's between 18 and 22 days to see a specialist.
I will say, since he's kind of talking about it a little bit, the actual care that you get in America, like when you do go into the emergency room or the doctor or the surgeon, we have some of the best medical care in the world. That's not a problem. Anytime I've been to the hospital, it's been a fantastic experience. The experience is not the problem. It's the cost and the insurance and the people who are really getting screwed by that system and spending the rest of their life paying off their cancer treatment or something while living in America. It's yeah.
In both countries, healthcare costs are rising, but there are a lot of factors that go into that. Popularity for each system also drastically different. In the United States, a Gallup poll shows our healthcare system has an approval at around 38%.
I'm shocked it's that high. And I assume what they're approving of is the health care. Like, it's good care. They're not approving of the healthcare system, I think. I don't know the question they asked in this poll. 38%, so 62% of Americans do not approve of the system.
In Canada, surveys regularly show approval for the healthcare system is in the 80s. In a recent
There you go. 80+% approval in Canada. That kind of speaks for itself.
Poll showed 60% of Canadians are willing to pay even more in taxes for expanded coverage.
Right, this is kind of what I was saying before. Americans would be over the moon to pay taxes and get health care covered. Don't have to think about it. Just pay your taxes, and that's what some of your taxes go towards. You're still paying for your health care, but it's in the form of taxes. That'd be wonderful. And many Canadians would pay more in taxes for expanded coverage. I think Americans would be in the same boat.
There are tons of other aspects we don't have time to look into, like prescription drugs and the arguments some make over quality of care. but these are some of the basic numbers and facts that we could dig up when comparing the United States and Canadian healthcare systems.
Yeah, that was a good little video, honestly. Yeah, they didn't even talk about prescription drugs, how much drugs can cost in America. Yeah. Anyway, this video is by 13 on Your Side, and I gotta give it a like, cause I I enjoyed how they presented it. I didn't enjoy some of the information, that some of the realities they were expressing, but I do enjoy bringing this kind of front and center into the limelight and learning more about the Canadian healthcare system. To finish this off, I do have something on a bit of a lighter note. This little short video, that's a comedy about how an American behaves when they're in another country, like Canada, receiving healthcare.
Well, sir, everything checks out. You're going to be just fine. Oh, that's great. What a relief. So you're all set to go. Okay. How much do I owe you? I'm sorry? For the visit. Do I pay on the way out or? No.
This is very relatable. Although, what's not relatable is if you would not have to ask how you pay. They are going to make sure you know where your bill is. They're going to make sure you know that you have to pay and how much. And that way, you'd never have to ask. That's the only part of this that's not true.
Why would you do that? Oh, I just received health care. Do you need my mailing address? Do you want us to mail you something? Oh, you know, for the medical bill.
Right. Oh.
I'm not paying anything today, so I can give you my address and you can mail me a bill later.
The fact that this is not relatable for some people around the world blows my mind. Like, I feel like that would be such a stress lifted off of so many people, and like maybe the number one most stressful thing for a lot of people in America, the whole healthcare system, would just be like lifting it all off their shoulders.
Usually I have a copay and a deductible and 20% co-insurance until I reach my out-of-pocket maximum, assuming insurance approves all my prior authorizations. So, I'm fine paying.
It sounds absurd, but it's totally true what he just said. All this, whatever he just said, it's all true. All that stuff.
What? So I don't have to pay anything? No.
Ridiculous.
So anybody who needs healthcare can just come in here and get healthcare for free. Yeah.
For free. I see the for free thing. I know that's not true. Like, Canadians are paying taxes. It's not free. But comparatively to Americans and how we're literally getting bills in the mail for like thousands of dollars if you're going to the ER, then it's free.
What's the catch? Excuse me? Nobody just gets stuff for free, much less the opportunity to live a healthy life free of disease. So what's the catch?
Oh, man.
There's no catch. Did you take out one of my kidneys when I wasn't looking?
Okay, there you go. I thought that was both funny and disturbingly accurate. So, anyway, I always enjoy kind of going over this, learning about the Canadian healthcare, comparing it to the American healthcare, and yeah, just enjoying that whole process and really having a good time bringing that discussion forward. And I don't know. Hopefully one day this whole mess can change, but it's a bit grim for now, so it's nice to see how other parts of the world like Canada do it, and that there is a possibility of being like that one day. So I enjoyed it. Anyway, if you enjoyed this as well, feel free to give this video a like or leave a comment. And if you're interested in more videos like this, me reacting to Canada and Canadian culture and stuff about Canada that I've just never seen or learned before, feel free to subscribe for more. And until then, Thanks for watching, and see you next time.